Let us tell you about the funding program Hospital Partnerships, Partners Strengthen Health, from the project idea to the funding application. Ms. Schmidt from Germany is working together with Mr. Choga from Ethiopia on a project to improve the hygiene conditions in his hospital. Their commitment and professional exchange are important to us here at the Hospital Partnerships, which is why we want to support them with their application. Ms. Schmidt starts her application in the Hospital Partnerships application portal. Some of the information can be entered into the online template. She writes additional information into the forms provided. The project application document is the heart of the application. The project application asks for details on the national context and target group, relevance and sustainability, as well as risks and the partner's own contributions. This helps Ms. Schmidt and Mr. Choga to consider their project from different perspectives. In terms of the national context, they ask themselves, which other stakeholders are working on the ground? Would it be helpful to network with these stakeholders? Regarding the target group, they discuss whom should the project reach, who can communicate content and messages to these people. Thanks to this preparation, the project starts to take concrete shape. In the project application, they pay special attention to the project plan. In the plan, they describe their project transparently and comprehensively. To do so, Ms. Schmidt and Mr. Choga again review the problem that they want to solve with their project. This enables them to develop a clear picture of the results they want to achieve in their project. They define one main objective. When doing so, they make sure that the objective is clearly outlined and can be achieved within 2 years. The financial and human resources also need to be evaluated realistically. Ms. Schmidt and Mr. Choga then ask themselves how they can measure whether they are getting closer to achieving their objective and whether the desired changes are taking place. To answer their questions, they come up with 2 meaningful indicators. These describe which results should be achieved for which target group and in what period of time. This allows them to identify needs, which helps with the planning process. During the project implementation, the indicators are used to measure progress. Have new skills been acquired? Are the necessary structures available? Ms. Schmidt and Mr. Choga use this approach to check whether they are still on track. At the end of the project, the indicators help to analyze the project results and compare them with the situation at the start of the project. In order to measure and illustrate progress by using the defined indicators, the 2 partners need suitable measuring instruments. Mr. Choga evaluates which methods are suitable and which data or documents they can take into account. Furthermore, they determine a base and a target value so that they can compare the situations. If in doubt, they enter estimates. But what does it look like in practical terms? Ms. Schmidt and Mr. Choga specify their objective. Introducing standards to prevent and control infection inhibits the occurrence of pathogenic microorganisms. As a first indicator, the partners choose the WHO guideline on hand hygiene is being followed. In the course of the project, the compliance rate should improve from a current rate of 50% to more than 80%. Additionally, they choose a second indicator. The post-cesarean infection rate is decreasing. The partners both agree that the evaluation of hygiene inspection and observation reports is a good measuring instrument for Indicator 1. To measure Indicator 2, they want to use hospital documentation. Ms. Schmidt and Mr. Choga finally ask themselves which concrete activities are required to achieve the project objective. Depending on the project, there can be up to 8 main activities. These will also be reflected in the financial plan. They now add who will carry out the activities, by when and with whom. They specify groups of people and avoid stating names. Once the project application is finished, Ms. Schmidt uploads it to the application portal. If all fields in the online template have been completely filled in, the application can be submitted. Do you have any questions? Please feel free to contact the advice team. We wish you the best of luck with your application. www.hospitalpartnerships.org